Masturbation is a natural and healthy part of life, no matter your age. But once you hit 60, your body starts to change in ways you might not expect. What felt easy and pleasurable before can sometimes become uncomfortable or even painful if you're not careful. Many older men make common mistakes during masturbation that quietly harm their bodies, things like ignoring pain, overdoing it, or skipping simple steps, such as using lubricant. These small habits may seem harmless, but over time they can lead to irritation, infections, or long-term damage. In this video, we're going to explore these mistakes in detail and share practical tips to help you enjoy intimacy safely and comfortably well into your later years. Taking care of your sexual health after 60 is important, and with the right approach, you can keep your body happy and your pleasure alive. Section 1. Why masturbation matters after 60. Masturbation is often seen simply as a source of pleasure, but its importance extends far beyond that, especially for men over the age of 60. As we grow older, maintaining sexual health becomes a crucial part of overall wellness, impacting not only physical health, but emotional and mental well-being as well. After 60, many men experience natural changes in their bodies. Testosterone levels gradually decline, and prostate health can become a concern. These changes sometimes affect libido and sexual performance, which can lead to frustration, anxiety, or even feelings of isolation. Masturbation offers a safe and private way to stay connected to your sexuality, helping to preserve your sexual function and sense of intimacy. But it's not just about maintaining desire. Masturbation stimulates blood flow to the genital area, which is vital for keeping tissues healthy and responsive. It can help maintain erectile function by encouraging regular circulation and muscle tone in the pelvic area. Regular sexual activity, including masturbation, has also been linked in some studies to a reduced risk of prostate cancer. This is thought to occur because ejaculation helps flush out harmful substances that could build up in the prostate over time. Beyond the physical benefits, masturbation also plays a role in managing stress and promoting relaxation. The release of endorphins and other feel-good hormones during orgasm helps reduce tension, improve mood, and support better sleep, issues that become increasingly important with age. In fact, many men find that regular masturbation can help them navigate the emotional challenges that sometimes come with aging, such as loneliness or changes in self-esteem. However, because the body changes with age, what worked in your younger years might not be the best approach now. The tissues become more delicate, healing takes longer, and sensitivity can shift. Understanding these changes and adapting your habits is key to continuing to enjoy masturbation safely and healthily. So masturbation after 60 isn't just a habit or a pastime. It's an important part of caring for your sexual and overall health. Embracing it with knowledge and care can improve your quality of life, boost your confidence, and keep your intimate wellness intact well into your later years. Section 2. Mistake number 1, being too rough. If you're over 60, it's time to rethink the way you've been doing things. What worked when you were younger, quick, rough, and forceful, can actually be causing hidden damage now. Why? Because the body changes with age, and that includes some very delicate parts that deserve a little extra TLC. Think about the skin on your face or hands as you get older. It gets thinner, more fragile, and sometimes a little more prone to irritation, right? Well, the skin on your penis is no different. Being too rough can lead to tiny tears, redness, or soreness that sneak up on you without much warning. At first, it might just feel like a little sensitivity or discomfort, but over time, those small injuries can add up, leading to infections or painful inflammation. Imagine this. Every fast, rough stroke is like sandpaper rubbing on delicate skin. Eventually, that skin cries out for relief, and that's when problems like balanitis and inflammation of the head of the penis can start. And trust me, that's not a feeling you want to get familiar with. Dr. James Parker, a urologist with decades of experience, often reminds his patients, you wouldn't scrub your face roughly every day, so why do it down there? The answer? Slow it down, be gentle, and give your skin the respect it deserves. One of the easiest ways to avoid this is by using lubricant, and plenty of it. Water-based lubricants are your best friend here. They help reduce friction, making every movement smooth and comfortable, almost like a well-oiled machine. And no, using lube isn't just for younger guys or people in relationships. It's a game changer for anyone wanting a safer, more enjoyable experience at any age. Section 3. Mistake number 2. Ignoring pain or burning. One of the most common and dangerous mistakes men over 60 make when masturbating is ignoring pain or burning sensations. It's tempting to dismiss these feelings as normal signs of aging or just minor irritations that will pass. But pain and burning during or after masturbation are your body's way of signaling that something isn't right, and ignoring these warnings can lead to serious health issues. Pain or burning can stem from a variety of causes, many of which require prompt medical attention. For example, infections of the urinary tract or the prostate are common in older men and often show up first as discomfort during sexual activity. These infections can cause inflammation, swelling, and even bleeding if left untreated. Similarly, prostate inflammation or prostatitis, which becomes more common with age, may cause pain during ejaculation or a burning sensation in the urethra. This condition isn't just uncomfortable. If left unchecked, it can affect urinary function and overall quality of life. Another cause of pain could be urethral strictures or blockages, which restrict the flow of urine and semen, leading to painful sensations and difficulty with ejaculation. These are not problems to ignore or hope will resolve on their own. Ignoring these symptoms can turn a manageable issue into a chronic problem that's harder to treat later. It's important to understand that while masturbation itself is healthy, it should never cause pain. If you experience burning or soreness that lingers beyond a day or two, or if you notice blood in your urine or semen, it's critical to seek medical advice immediately. Waiting too long to address these signs can result in complications such as chronic infections, scarring, or even damage to the prostate or urinary tract. Early diagnosis and treatment often mean a quicker recovery and a return to comfortable, enjoyable intimacy. Remember, your body communicates with you constantly. Pain and burning are loud signals saying, "Pay attention, something needs care." The moment you notice these symptoms, don't brush them off or push through the discomfort. Reach out to a healthcare professional who can diagnose the issue and guide you towards the right treatment. Taking action early isn't a sign of weakness. It's a smart way to protect your health and maintain your quality of life. Your sexual health after 60 deserves the same attention and respect you give to the rest of your body. Section 4. Mistake number 3. Overdoing it. Masturbation is a natural and healthy part of life, but like many good things, it's possible to have too much of it, especially after 60. One of the biggest mistakes older men make is overdoing masturbation, pushing their bodies beyond what they can comfortably handle. In younger years, it might have been easy to bounce back quickly from a vigorous session, but as the body ages, recovery takes longer. The tissues become less resilient, blood flow slows, and sensitivity can increase. Masturbating too frequently or with too much intensity can lead to irritation, soreness, and even long-term damage if the body isn't given time to heal. Overdoing it doesn't just affect the physical body, it can impact emotional and mental health too. Men who masturbate excessively may find themselves feeling drained, fatigued, or even anxious. There's also the risk of creating a cycle where masturbation is used as a coping mechanism for stress or loneliness, which can lead to compulsive behavior that is hard to break. Physiologically, too much stimulation without adequate rest can cause swelling or inflammation in the penile tissue and surrounding areas. It can also lead to a condition known as overuse syndrome, where the nerves and muscles become hypersensitive or fatigued, resulting in discomfort and decreased sexual pleasure over time. The balance between staying sexually active and giving your body time to recover is crucial. Masturbation after 60 should be about quality, not quantity. Listening to your body is the best guide. If you notice any pain, soreness, or decreased sensitivity, it's a sign to slow down and allow time for rest. Men who maintain a healthy frequency report better mood, improved sleep, and greater sexual satisfaction. But pushing too hard or too often can backfire, leaving you feeling worn out rather than revitalized. The key is to understand your body's new rhythm and adjust accordingly. Moderation isn't just about numbers. It's about being in tune with what feels good and what feels like too much. Embrace a slower, more mindful approach to masturbation that honors the changes your body has undergone over the years. Remember, your goal isn't just to get through a session. It's to enjoy it, feel good, and support your sexual health for the long haul. Overdoing it might feel satisfying in the moment, but the long-term cost isn't worth it. Section 5. Mistake number 4. Poor hygiene. One of the silent but serious mistakes many older men make around masturbation is neglecting proper hygiene. It might seem like a simple or even obvious step, but poor hygiene can lead to a cascade of uncomfortable and potentially dangerous health problems, especially after 60, when the immune system isn't as robust and the skin more vulnerable. When you masturbate, your body produces natural oils, sweat, and sometimes even tiny amounts of bodily fluids that can linger if not properly cleaned. Over time, this buildup can create the perfect environment for bacteria and fungi to grow. This is especially true for men who are uncircumcised, where the area under the foreskin can trap moisture and germs if not washed regularly and thoroughly. Neglecting hygiene can lead to infections such as balanitis, which causes redness, swelling, and itching on the head of the penis. These infections aren't just irritating, they can cause real pain and interfere with your ability to enjoy intimacy. In some cases, poor hygiene can also lead to urinary tract infections, which tend to be more severe in older men and may require medical treatment. Beyond infection, poor hygiene can cause unpleasant odors and discomfort that affect confidence and social life. This can create a negative feedback loop where a man feels embarrassed or reluctant to engage in sexual activity, which in turn can harm emotional health and intimate relationships. Proper hygiene is about more than just cleaning. It's about protecting your health and your enjoyment of life. Washing your hands before and after masturbation is a simple step to reduce the risk of introducing bacteria. Gently cleaning the genital area with warm water and mild soap helps remove oils, sweat, and bacteria without irritating sensitive skin. Avoid harsh soaps or excessive scrubbing, which can dry out or damage delicate tissues. Also, pay attention to the tools you might be using, such as sex toys or lubricants. Make sure any toys are cleaned thoroughly before and after use, and choose lubricants that are gentle and designed for sensitive skin. Incorporating good hygiene habits into your routine is one of the easiest and most effective ways to avoid discomfort and infections. It's a small investment that pays off by keeping you healthy, comfortable, and confident. After all, caring for your body this way shows respect for yourself and supports your sexual well-being well into your later years. Section 6. Mistake number 5. Skipping lubricants. For many men over 60, lubrication is often overlooked or dismissed as unnecessary. But skipping lubricants during masturbation is a common mistake that can quietly cause discomfort and harm over time. As the body ages, natural lubrication decreases, making dry friction more likely and more damaging. When you rely solely on natural moisture, it may not be enough to protect the sensitive skin of the penis from the constant rubbing that occurs during masturbation. This lack of sufficient lubrication leads to increased friction, which can cause irritation, redness, and even tiny tears in the skin. These small injuries may seem minor, but they can lead to persistent soreness or infections if left unchecked. Many older men find that masturbation without lubricant becomes uncomfortable or even painful, but instead of adjusting their habits, they might push through the discomfort or avoid the activity altogether. This is unfortunate because the solution is simple. Adding lubricant transforms the experience, making it smoother, safer, and far more enjoyable. Choosing the right lubricant is important. Water-based lubricants are generally the safest and easiest to use, especially since they don't cause irritation and are easy to clean. Silicone-based lubricants last longer and can provide more glide, but they may require more effort to wash off and might not be suitable for all skin types. Some men even prefer natural oils, though these can sometimes interfere with condoms or cause allergic reactions, so it's best to be cautious. Using lubricant doesn't just prevent physical damage, it also enhances pleasure by reducing friction and allowing for a more relaxed, gentle motion. It encourages slowing down and tuning into your body's responses rather than rushing or forcing stimulation. If you've been skipping lubricants, consider this a wake-up call. Introducing lubrication into your routine can make a huge difference in protecting your skin, avoiding pain, and maintaining a satisfying sexual experience well into your later years. Remember, lubrication isn't a sign of weakness or a crutch. It's a simple tool to keep your body comfortable, healthy, and enjoying intimacy on your own terms. As we've seen, masturbation after 60 isn't just about pleasure. It's about caring for your body and respecting the changes that come with age. The mistakes we talk about today might seem small, but they can quietly cause harm if left unchecked. By listening to your body, practicing good hygiene, using lubrication, and knowing when to seek help, you're taking powerful steps to protect your health and maintain your confidence. Remember, aging doesn't mean giving up on your sexuality. It means adapting and embracing it in new, mindful ways. Your sexual health is a vital part of your overall well-being, and it deserves attention and care. So take these lessons to heart, be kind to yourself, and enjoy the journey with greater comfort and joy. Thank you for watching, and here's to a healthy, happy, and fulfilling intimate life at every age.